The next abstract will be presented by Dr. Park and colleagues, again from Seoul, the impact of postoperative complications to long-term oncologic outcomes of laparoscopic low anterior resection for rectal cancer. Dr. Park.
Thank you, Chairman. Good morning, ladies and gentlemen. My name is Eun-jung Park from Yonsei University from Korea. Today, I would like to speak about the impact of postoperative complications to long-term oncologic outcome of laparoscopic low anterior resection for rectal cancer. We have no disclosures. The laparoscopic surgery showed similar long-term oncologic outcomes compared to open surgery and robotic surgery. The rate of postoperative complications of laparoscopic corrected surgery showed about 20 or 30% according to the randomized controlled trials. However, previous the studies was focused on the rate of rate of postoperative complications. However, there was no studies the report about the association between the postoperative complications and the oncologic outcomes. So we aimed to investigate the impact of postoperative complications of laparoscopic low anterior resection for rectal cancer to long-term oncologic outcomes. From 2005 to 2012, there was 686 patients in our hospital who underwent laparoscopic low anterior resection for rectal cancer. We selected these patients by inclusion and exclusion criteria. The exclusion criteria involved the abdominal perineal resection, Hartmann operation, and stage 4 rectal cancer, and the postoperative mortality within 1 month. So then we divided these patients in 2 groups, the complication group and non-complication group. The Kaplan-Meier method and the Cox proportional hazard regression model were analyzed was used to analyze the survivors and prognostic factors. So now I show the result of our study. The complication group has more males, and weight and height had no statistical difference between 2 groups. And previous operation for abdominal surgery had these groups had the non-complication group has more rate of abdominal surgery, and other factors has no significant difference. In perioperative outcomes, the complication group had a longer operation time, a larger amount of intraoperative bleeding amount, and the higher rate of conversion, and the longer length of hospital stay. And the pathology outcomes between non-complication group and complication group had no significant difference for TMS staging, histologic differentiation, and the resection margin, and the CRM involvement in all parameters. We think because it is for the large numbers of cases. And we described the postoperative complications by the Clavian classifications. There were the 6.3% of the grade 1 patients, and the grade 3, which needs to surgical intervention, was the 13% in all patients. And there were 3 cases of grade 4. And this graph shows that the 5-year overall survival rate. In the overall survival rate, all stages patients had no significant difference between 2 groups. However, the stage 1 patient had a significant difference because the non-complication group in patients has a higher rate of overall survival rate. In stage 2 and 3 had no significant difference. And the 5-year disease-free survival rate, the patient with all stages and stage 1 showed the significant difference between 2 groups. Non-complication group patients showed the higher rate of disease-free survival rate. However, the patients with stage 2 and 3 had no significant difference. And we compared the 5-year survivors by dendrocrine classifications. We compared these groups by dendrograde 3 because it needs the surgical intervention. So the results show that the 5-year disease-free survivor with dendrograde 3 and 4 had a low rate of 5-year disease-free survivors. However, the overall survival shows no difference among these groups. And the local recurrence rate, the complication group had a higher rate of local recurrence than non-complication group. The local recurrence rate was 7.8%. Then we analyzed the prognostic factors to affect 5-year disease-free survivor and overall survivors. So our results show that the age and conversion, TMS staging, and histologic differentiation, and harvesting numbers of lymph node, and the lymphovascular invasion were the prognostic factor to affect 5-year disease-free survivor. And moreover, interestingly, the postoperative complications was a prognostic factor to the 5-year disease-free survivors. And the 5-year overall survivors, the prognostic factor shows that age, conversion, TMS staging, and histologic differentiation, lymphovascular invasion, and CR involvement was the prognostic factors to affect the 5-year overall survival rate. And according to the multivariate analysis, the TMS staging, harvested lymph nodes, and postoperative complications was the prognostic factors to affect the disease-free survival rate. And in overall survival rate, the age, TMS staging, histologic differentiation, which are related to the pathologic characteristics, were the prognostic factors to affect the 5-year overall survival rate. However, the postoperative complications was the only factor to affect the 5-year disease-free survivor, not the overall survivors. And the hazard ratio with postoperative complication was 1.6 in the postoperative complication group. Therefore, we focused and investigate to the postoperative complications after laparoscopic or under resection for rectal cancer can affect the long-term oncology outcomes. In our research, the disease-free survivors and local recurrence can affect by the postoperative complications in all stages. And we can suggest that from our research, especially in stage 1 patient, it is important to pay attention, the more pay attention to avoid and to prevent postoperative complications because it is related to the long-term oncology outcomes. Thank you for your attention.
Questions? Can you tell us the median follow-up interval?
Yeah.
What was the median time the patients were followed up?
The median follow-up period about
3 years, yeah.
Months.
All right, and then the hazard ratios are fairly important. The hazard ratio for stage 3 was what, 3.6?
Yes.
Versus stage 1.
Yeah.
The hazard ratio for a complication was 1.6.
Oh, yes.
So it seems like the dominant factor in the analysis was stage of disease, which we would expect would correlate with recurrence rate, especially early recurrence rate.
Yeah.
So that makes sense to me. The question is, you make a specific point about stage 1 and complications. So maybe you could tell me again, what was the difference in local recurrence or recurrence in just your stage 1 patients with and without complications?
I think the association between local recurrence and postoperative complications have the characteristics of postoperative complications. In our research, the integrated 3, more than integrated 3, such as anastomosis leakage and the viscera, it was the rate to develop the complication with the integrated 3 is very similar in all stages.
I see.
So I think it can affect the result.
Thank you very much. We'll need to move on to our next paper. Thank you very much, Dr. Park.
Thank you.